Hey guys, Tony Maritato, physical therapist. So I've been getting a lot of questions related to how to improve knee flexion, how to get more bend in the knee, especially for clients who have been 3 months, 6 months, 9 months after surgery and they're still struggling to get past 90 degrees, or some people even to get to 90 degrees. So I want to start with just a little bit of background. Stay with me because I'm going to show you how to make a homemade dynamic splint for pennies on the dollar. This right here is what a normal dynamic splint looks like, and these things could cost hundreds of dollars. But I'm going to show you what I do for individuals who don't want to spend that kind of money but still want something comfortable, fast, easy to make. Let's talk about what's limiting the range of motion. First off, there's lots of things that could be limiting your range of motion. I'm going to focus this video on people that are less than 90 degrees of flexion. So certainly it could be swelling. If you have pain and swelling remaining in the joint, that is absolutely going to limit your ability to gain range of motion. Now that doesn't mean you'll never get range of motion. That just means it's limiting the available range of motion you have. If I have a pebble in my shoe, I'm not going to step on that because the pain of the pebble is going to cause me to pull away. Right? So it's the same inside the knee. If the knee is swollen, if the knee is red and painful, that is going to be a major factor in limiting your range of motion. You might have the range in the knee, you just can't get to it. Other factors. Certainly we all hear about scar tissue. There's lots of concern about scar tissue, but I think we need to consider, I've done a separate video probably a year ago where I showed you how it depends on how tightly they sew up the joint. And I think this is an important question for the surgeon. From a surgeon's perspective, they have a choice. They can give you a looser joint that will get amazing range of motion but might be unstable in the future, or they can give you a tight joint that might limit range of motion but give you far more stability. Stability is super important when you're dealing with any kind of post-surgical outcome. So, you have to talk to your surgeon about that, hopefully before surgery. If you're watching this, you've already had surgery. But anyway, how tightly they sew up the joint capsule, the size of the implant they use, the integrity of the ligaments around the knee. There's so many things that contribute to your ability to gain range of motion. But how can we improve what we have if we're dealing with less than 90 degrees of flexion? I'm going to show you what you guys have been waiting for. Super simple hack. So this is what we call just generically TheraBand. That's the brand name. This is the wide, flat, thin band. There's lots of bands on the market nowadays. This stuff usually comes either in a long roll. I think they sell a 10-foot roll, 50-foot roll, or you can get I think it's a 5-foot piece. But anyway, I'm going to give you kind of the poor man's version of a Dynasplint that is literally pennies on the dollar. So basically what we want is we want something that's going to give us the knee bend, long duration, low intensity. And when I say long duration, I'm usually looking at between 5 and 10 minutes. I'm not looking for 3 hours or something crazy like that. And if you saw my last video, you know that my philosophy on how do you know if it's enough or too much basically revolves around how do you feel later. If I do this for 5 minutes and then 2 hours later I'm back to baseline, back to where I've been, perfect. I can try 7 minutes and then I can try 10 minutes. But if I do it for 10 minutes and I'm more sore and I have more pain and swelling 2 hours later or even that night, I did too much. I need to back it off. Okay, so let's take a look at this. Now you're probably going to have somebody who can help you set this up. Kind of the optimal way to do something like this. So if I take the band, I fold it over and I just create a loop. Now I've got this little loop, right? I can put that loop over my foot. Now what I do is I create some tension on the band. I come up high into the hip, right into where the hip crease is. And what I'm going to do is I'm going to wrap around. Now, I like to do it with a thick pair of pants, maybe sweatpants or something like that. And then what I'm doing, I don't know if you guys will be able to see this, I'll try and zoom in, is I'm just going to tuck that under. So now if this gets uncomfortable, I literally just pull that out and it'll come right off to release the pressure. But I pull, I go deep into the hip, I tuck it so I don't tie it. I'm never going to tie it. This isn't a tourniquet. And basically, look at what's happening. So right now, the band is pulling my leg into flexion. Now there's a couple positions I can get into. If I have a ball, some of you might have one of these balls at home, I can lay back. Hopefully you guys can still hear me. And so what's happening is the rubber band is pulling me back into flexion, and I'm just completely relaxed here. I'm not doing anything. If I don't want to use the ball, what I can do is from this position, I let it pull me back into my end available range of motion. I rest my foot down on something that, you know, you've seen, like the baking pan tray, a furniture slider, you know, anything like that. But the idea is something that will let my foot just gradually slide back. And what I'm really doing here is, it's this long duration, low intensity, comfortable stretch. Now, if this gets uncomfortable here, I can place a towel, a hand towel, a bath towel, something like that, to wrap it around that. I don't ever want you to compromise circulation or cause some compression up in the thigh. A lot of you already have damage to the tissue because of the tourniquet that might have been used during the knee replacement. This up here should be very comfortable. And then I'm going to spend 5 minutes to start, maybe progress to 7. I wouldn't do more than 10. Once I've achieved kind of my maximal range of motion, then I'm just going to go ahead, I'm going to unwrap that, take this off, let this relax back into extension, and just give the knee a break. You know, what we're trying to do is we're trying to cause a little bit of tissue irritation, not so much that it doesn't heal within an hour or two, but enough that it triggers a response in the tissue. I always say, like, think about the last time you were shoveling in the garden. If you shovel too quick, you get a blister. If you don't do enough, nothing happens to your hands. But if you irritate the skin, you develop a callus. A callus is that tissue thickening and growing. That's almost the same response that we're trying to get through the connective tissue in the knee. We want enough stimulus, enough stress, that we trigger a response to lay down more tissue, but not so much that we cause increased pain, swelling, and inflammation. So guys, it's a delicate balance. If you have questions, let me know. If you try this strategy, let me know. I'll put a link to the kind of band that I use in the description of the video. Keep me posted. Let me know in the comments what your thoughts, what your questions are, if it works for you, if it doesn't. Guys, as always, thank you so much. I'll catch you on the next video.